My people, hello, and welcome to my YouTube channel. If you're new here, thank you so much for joining us. Thank you so much for joining us. And please don't forget to subscribe and hit the notification button down below so that you can get notified whenever I post a video. So just a quick one, just a quick background about myself. My name is Bridget, currently working at the medical ward. I've been a nurse for 6 years now, and actually doing the 7th year this year. Started in April, yeah, the 7th year this year. So I just want to share with you guys my thoughts on what I wish I knew before becoming a nurse. Those are my thoughts. Okay, let's get into it then. So I just want to share a story with you guys, just to link it up with the topic of today so that you understand where I'm coming from. So before the story, I just want to let you know that I'm not here to scare anyone from becoming a nurse. This is just the reality in the field. So here goes my story. So I had this childhood friend who was to go for an introduction, but he did not tell me that. So he called me on a Wednesday back then in 2018 when I was still in nursing school. So he called me on a Wednesday to just get myself ready. So on a Friday I went. I took out the leave out sheet because our school you couldn't have gone outside without a leave out sheet, just like a normal university or college. So I took my leave out sheet on a Friday, and then on a Saturday I dressed in this African short attire, this African print attire, a shirt on the top, and I was looking amazing. And then, by the way, in our school we were not allowed to wear shorts and trousers. So in such a case that I'm putting on shorts, I could wear a very big dress just to cover the shorts, and not there was some spices just there to spy on us, on who is wearing shorts and who is wearing trousers, just so that you know that college life. So fast forward, on a Saturday I found my bestie waiting for me at the gate. We started our journey. We went to Kisii. So I was like, where are we going to Kisii? He told me just to relax. So we left. We reached Kisii. Apparently the guy was going for an introduction. Yeah, and I had worn my casual, just thinking it's a casual Saturday, just we usually hang, but that was on a Saturday. And I noted, by the way, he had worn a suit, but it didn't click. So that day it was so embarrassing. I couldn't even go outside that car. I stayed in the car the whole time. I was brought for food there and everything there. Just it was so embarrassing. So this is to link you up with the topic. It's better you know where you're going to before you reach the place, then you find out what it's in the place. Okay, so if my bestie could have told me we're going for an introduction, I could have dressed according to the occasion, but he did not tell me so. So I dressed opposite totally. So I hope that will click, that will link you up to the topic. So let's go. I have like 6 things to share with you, and if in the 6 things I shared, and you think that I have skipped something, and you think that you passed across something different that I passed across, or you got into something that I did not maybe touch on, kindly just leave a comment on my comment section, and let's help these kids, let's help these people who aspire to be nurses, let's help the new nurses who are coming to the field. Okay, let's. So the first thing that I wish I knew before becoming a nurse is, in nursing or any other medical field, learning never stops. So in nursing or any other medical fields, learning never stops at all. So if you're a student and you have those textbooks, exercise books, please keep them. You will need them in future as you progress with nursing. So I remember back in 2016, after I just done with our nursing council examination, some of my colleagues were selling their books, some of them were giving out to the hind classes, and I'll just advise you not to do so. Please don't do that. And still on the learning bit, I'd like to advise for those nurses who are new and the old ones in the field, please always carry a small notebook just to write down any new conditions or new medications you come across in the field or during your shift. Okay, when you get time, maybe during your shift or after your shift, you can just go through them, or during ward rounds, when you go for ward rounds and then you meet some new conditions that you guys are discussing during ward rounds, just note it down and just go through it after your shift or during the in between the breaks. Okay, so nurses require intelligence and critical nursing. Gone are the days where nurses were following doctor's orders, like, doctor said this, doctor said we do this, doctor said we do this. No, long are the days. So learn to challenge doctor's orders, but positive challenge, not the one that will bring fracas. Just a positive challenge. Try to ask the doctor questions, because you're the one who is staying with these patients for long, more than them. Then they always come for ward rounds, just 5 minutes and they're gone. You will stay with this patient for 12 hours. Others will stay for the patient for 8 hours. So you know this patient in and out. So share your thoughts with the consultants, share your thoughts with the doctors. We are raising smart nurses. Okay? Please actually be a smart nurse. We are raising smart nurses and intelligent ones at that. Okay. And to my second topic, nursing is not a glamorous job. It's not a fairy tale. It can be nasty. We go home with scrubs full of blood, full of pee, full of poop. It can be gross. If you have a weak stomach, you will have to toughen up before you come into the field. So I remember when I started my career, I had that weak stomach, and any bad smell really nauseated me. I'll literally vomit, just thinking that I'm going to the hospital and dress wounds and do all that. But fast forward a few years later, those things don't bother me at all. In fact, you can have a patient who has been constipating for kind of 7 days. Yeah, and then you do some laboratory investigations, you do radiology investigations, and you just find out that the patient has been having fecal impaction. Then you put the patient on a stool softener, in this case an enema. We do it parectal, and then the patient just passes stool. Do you know the joy that comes with that? Only my fellow medics can understand the joy that comes with seeing a patient who has been having fever, who has been having palpitation, just passing stool, and the fever goes down, and there will be normal palpitations. The patient is so happy, thanking you, jumping up and down, So that will quicken the patient's hospital stay, and you will have brought joy to this patient. Okay, so literally, anyway, I just want to tell you, I'm not here to scare you again. I am not here to scare anyone. These are the things that happen in the field. So brace yourself and toughen up, because mama didn't raise a weakling. So nurses should be strong. Let's just take in what we got in the field. And to my third topic, I just want to kind of quicken it up. Okay. So my third topic is burnout and fatigue that comes with nursing. First, I'd like to let you know that a hospital is a business. Okay, and sometimes it can interfere with ethical issues. So just prepare to possibly have to deal with that sometimes in your career. Okay, so I want to talk a little bit about burnouts and fatigue that we experience, not only nurses but any other field, that the burnouts that you experience, it can be kind of sad sometimes being a nurse, especially if you get attached to a patient. Like you get attached to a patient and you see unfavorable outcomes, and you go home feeling so sad. This patient takes a turn to the worst. This kind of weighs on you, and you go home, you feel so sad, and like it interferes with your whole self, both at home and in the hospital. Some hospitals don't have these psychotherapy sessions for nurses, which is very okay, because after all those burnouts, you just have to have some healthy coping mechanisms to deal with that. Another thing that weighs us down is the perception about nurses outside there. So people think that nursing is kind of caretaker job, a house girl kind of job. So you get to work and take care of both relatives and patients. So you'll come across difficult patients, you'll come across difficult relatives who order you around and want things to do, wants things to be done their way. Yeah, knowing that they always know that they are right. But these patients know that they are right. They know their rights nowadays. So I just want to advise you to never argue with a patient or a relative. Just be the same person in the conversation. Find a continuum and talk it out. Okay? Talk to the patient softly. Talk to the patient smoothly. And I am sure, 100% sure, this patient will see sense in it. So my third point, burnouts and fatigue that comes with nursing. So I'd like you to know that a hospital is a business, okay? And sometimes it can interfere with ethical issues, that I just want you to prepare for possibility to have to deal with such, okay? I want to talk a little bit about burnout and fatigues that us nurses will experience in the field. Just it's kind of a side situation when you get attached to patients and you just see these patients going to unfavorable conditions and their health status just take a turn to the worst. This kind of weighs us down. So you should have a healthy coping mechanism that you'll just at least use, because some hospitals have these psychotherapy sessions for nurses and other medics, especially after losing a patient that you've been having this patient for kind of 6 to 7 days, and then the patient takes just a turn to the worst. So this kind of interferes us both in hospital and at our houses. Okay, so have that healthy coping mechanism that you will be using in such conditions. So another things that weighs us down is the perception about nurses. Outside there, people perceive nurses as some caretakers, as some house girls. So you go to the hospital knowing that you're going to take care of these caretakers or relatives of the patients and patients themselves. I can assure you, you will find very difficult patients and very difficult relatives. So always find a continuum and talk through with the patients. Just always talk. You find a patient or a relative just shouting at you for no good reason. I remember when I was when I was employed in a certain hospital, then a patient just rang a bell and I went, and he told me, hey, sister, kuna mosquito inazunguka hapa, hebu ichape. Sad. Huh? Yeah, you will find such crazy patients. Okay, so you just have to work with that. Talk to them softly, and even that patient who has been shouting at you or relative who has been shouting at you will see the sense in it, and they will actually come and apologize. Some will apologize, and some will just see sense in it, you know. So be the bigger person in that conversation. Never ever argue with these patients. Never argue with these patients. Just know that you did your best and let God do the rest. Okay. So until my fourth topic, Working under pressure. Being a nurse entails a lot of critical thinking, reasoning within your capacity in favor of a patient. So one of the qualifications of being a nurse is being able to work under pressure. So you have to learn to prioritize your conditions and your cases. For instance, you've just reported to work and you're being assigned 6 patients. Let's say the first patient has a fever of 38.7, the second patient is desaturating with an oxygen levels of 65. The third patient is post-thyroidectomy with a pain score of 8 over 10. And then the fourth patient is vomiting and diarrhea. So you learn to prioritize these conditions to know which one you'll be handling at first and which one at last. So if you're in such a condition, just breathe, take a second, take a breather, and work according to your priorities. So if you're that type of person or type of nurse that can't work under pressure, maybe you need to analyze that a little before you come into the medical field, because those situations can accelerate all those feelings. In such cases, learn to relax, learn to take a second, breathe, just take a deep breath, then sort your patients out. Okay, it is a very stressful career, it's a very stressful phase at times, and you need to be able to handle that stress effectively so that it cannot even overweigh you, because we don't want our patients to see you overwhelmed. Okay, even if you're overwhelmed, just put up that smile. Hi, we are doing well. Okay, then go to the bathroom and just say just breathe out, and then you proceed. Okay. And to my 5th point is schedules. Nursing stroke medicine, we don't recognize holidays at all. So we work weird hours, we work weird shifts, weird days. Some of us don't even go to church because we're busy attending to you, our clients. And that's, I know God will forgive us because of that. But this really affects these young couples that one is married to an non-medic who doesn't understand your schedule. So you just have to take them through your schedules. I have these colleagues of mine who just print the rota and just stick to their houses or give their spouses so that they can understand. But for those who understand our schedules, then you're good to go. So some hospitals have created systems that favor the staffs, especially during the Christmas holidays and New Year, so that some staffs can go to the holidays during Christmas and others during New Year. And also we have these pools and locums. A staff can call in sick and you are on your offs, so you are called back to work just to cover the shift. Please be flexible. Do that. Just know that you're doing it to your patients, not the hospital or no one. And yes, you're doing this to your patient, and you are that angel that God sent to this world to put a smile on those faces. So just brace up and go cover the shift. Okay, be flexible when you're called upon. So, unto my last and best point, I was saving the best for the last, is nursing diversities. So one thing I love about nursing is its diversity. You do not have to stick to that one field. You do not have to stick to bedside nursing. You can jump around and do pretty much anything. Okay, so if you want to be an ER nurse, if you want to be a critical care nurse, you can be a pediatric nurse, NICU, you can be a midwife. There are all those diversities. You can be a medical surgical nurse and all those diversities. Okay, so it's a wide field. It's actually a very wide field. You don't have to graduate immediately and go into another course. So what I'll advise is, after you graduate, take at least 2 to 3 years in the field, so that you can just learn and just go in with an open mind. Just learn about your interested path. You know, I remember when I finished school, I wanted to be a pediatric nurse, but I went into the field. 2 to 3 years later, I want to be a critical care nurse. So the last point that I like to leave with you is that although nursing is all these things that I just spilled out and gave you like 1,000 scary thoughts, one thing you need to know about nursing, it's a super rewarding career. Nursing is a very rewarding career. I will never choose any other career apart from nursing. So it's so rewarding in that if you see a patient coming in so sick, very sick, and they live very healthy, and these patients just keep on thanking you, keep on blessing you, keep on praying for you, all those blessings, there is nothing that beats that feeling. So being a nurse is super rewarding. We get our blessings here in earth. Here we get our blessings here on earth, and we just thank God for us. Okay, so thank you guys for watching. If you have experienced something that I may not have shared, or you think that I did not mention, kindly just leave that on my comment section so that we can help our young brothers and sisters who really wish to join us in our career. Until next time, bye bye for now.